Hey everyone, it's Raj from 3CB Performance. New Orleans Pelicans' #1 draft pick and much anticipated rookie phenom Zion Williamson has been diagnosed with a right knee lateral meniscus tear that required surgical debridement. In this video, I'll explain the injury, the procedure, 5 potential underlying causes for the injury, and why it's a serious issue moving forward. The meniscus is a dual crescent-shaped, force-absorbing, friction-reducing piece of cartilage that sits between the femur, thigh bone, and tibia, shin bone, within the knee joint. One half sits on the inner, medial aspect of the knee, and the other sits on the outer, lateral aspect of the knee. Although many meniscus tears don't require surgery, the Pelicans medical staff decided surgery was the best option moving forward. There are 2 surgical options for meniscal tears: removing the damaged cartilage, known as a meniscectomy or debridement, or repairing the damaged cartilage, known as a meniscal repair. Per the Pelicans' official statement, Zion had the former. The repair is only an option when the tear occurs in a part of the meniscus that is vascularized, meaning it has blood supply. Repaired tissue cannot heal without blood flow. As you move from the outer, peripheral part of the meniscus to the inner, central part of the meniscus, there's less and less blood supply, schematically represented as red, pink, and white zones. To that point, meniscus injuries are like real estate. It's all about location, location, location. A large bucket handle tear on the periphery of the meniscus would be more amenable to repair than a smaller tear that sits centrally. The research shows that the average RTP timeline for elite athletes after a repair is roughly 5.6 months, whereas the average RTP after a debridement is just 6 weeks. In line with that, the Pelicans have given a 6 to 8 week return timeline for Zion, which conservatively means he'll be back by mid-December. There's been considerable talk about Zion's weight and how that contributed to his injury. Gaining weight in and of itself isn't an issue when it's done methodically to build lean muscle in a leaner body composition. However, that didn't seem to be the case with Zion, as he looked noticeably less defined and rotund when he showed up for Summer League. To that point, his former coach, Coach K, said that Zion shouldn't have played in the Summer League at all because he wasn't in physical or mental game shape. Additionally, new Pelicans GM David Griffin also admitted that Zion wasn't in good shape, particularly from a cardiovascular conditioning standpoint. Unfortunately, we've seen this before from Zion. During his 2017 summer stint with USA Basketball, the very reliable and astute Jonathan Givney and Mike Schmitz noted that Zion looked, quote, heavy and out of shape. Fool me once, shame on me. Fool me twice. Additionally, Zion went for multiple months without focusing on his fitness after Duke's tournament exit in March, to playing 1 game in Summer League, to then participating in camp and playing in multiple preseason games with a Pelicans team that plays at a really high pace and running quantity. These large jumps in activity are a key risk factor for soft tissue, muscle, cartilage, ligament, tendon, bone injury, and, to that point, one of the main standards of sports performance and injury prevention is a formula called the acute to chronic workload ratio, which looks at your current level of activity, acute, compared to your overall level of activity, chronic. When the chronic level of training has either underworked or overworked an athlete relative to their current level, the research shows a 7x increase in soft tissue injuries. I've been concerned about Zion's movement patterns and mechanics since I saw him in high school, primarily his landing mechanics. Studying the film, Zion likes to land on one leg with his knee extended, occasionally on his heel as well. This is a trifecta of landing injury risk because it creates a huge shockwave of ground reaction force, GRF, upwards, with research showing a force upwards of 7x your body weight that is primarily absorbed by the joints because the muscles, the body's primary shock absorbers, are placed in a very disadvantageous position. In contrast, landing on the midfoot with knees flexed only creates a GRF that's roughly 3x your body weight, with most of the force attenuated by muscles rather than joints. The cherry on top is that the height Zion gets on his jumps further serve to significantly increase the force of landing. The second possible biomechanical factor is running mechanics. This is really difficult to tell from game tape alone, but the team can do a running gait analysis to check Zion's typical running stride for stride length and then correct as needed. Overstriding puts excess stress on the lower body because it typically means you're striking the ground with your heel with your knee extended, which, as we already discussed with landing mechanics, increases ground reaction force, GRF, and stress through the joint. Thirdly, I've seen and heard commentary on the way Zion walks and how that could be contributing to the knee problem. Typically, this lateral shift during stance phase can be indicative of weak hip abductors, primarily the gluteus medius, and or muscle tightness on the outside of the hip, particularly the tensor fasciae latae, TFL. However, I haven't seen much, if any, of that pattern carry over to the game. The question becomes, is his walking gait pattern more of a neuromuscular habit, or can we attribute it to some functional deficit? That's nearly impossible to answer without further assessment. I will say it's not uncommon to see players move differently in-game than outside of the game, or even move differently on similar in-game movements. For example, Steph Curry displays significant knee bulges on his jumper, but that doesn't translate to other in-game jumps or his walking gait. Zion is an incredibly high-energy, high-activity player, which when paired with his elite athleticism and drive makes him such a unique prospect. But it also leads to him playing with a reckless abandon that too often puts him into high-risk situations. These three characteristics remind me of Blake Griffin earlier in his career, where he was very liberal with his use of athleticism and explosiveness, leading to a plethora of high-risk situations. To Blake's credit, he learned his lessons and adjusted his game to understand when to and when not to use that explosiveness. It's a lesson that Zion will have to master as well. Further, a key part of Zion's game is using jarring lateral jump stops and hard pivot rotations. These remind me of a young D. Rose who relied on heavy shifting jump stops for acceleration and deceleration along with hard pivots and rotations for change of direction. I'm not saying Zion will share Rose's injury history, but these movements aren't the easiest on your body, especially when done repeatedly over time. In a period of 6 months, Zion had 2 insults to his left knee, a grade 1 MCL tear at Duke, and knee-to-knee contact during Game 1 of the Summer League that kept him out the remainder of the tournament. It's certainly plausible that these issues could have led to Zion favoring that left side and compensating with increased loading on his right leg and knee. Over time and reps, that increased stress, even if slight, can lead to downstream injury. Overall, there's a distinct possibility, in my opinion, that one, some, or all of these factors may have contributed to the lateral meniscus tear and subsequent need for debridement. Lateral meniscus debridements, or meniscectomies, are concerning for elite athletes because they can lead to arthritic changes in the knee in less than 5 years, whereas those changes may not be seen after a medial meniscectomy for upwards of 20 years. That stark contrast is due to anatomical and biomechanical differences between the lateral outer and medial inner compartments of the knee joint, respectively. The medial knee joint is larger and more stable because the outwardly rounded convex femur, thigh bone, sits neatly into the inwardly rounded concave tibia, shin bone. This convex-concave bony relationship is akin to a ball sitting into a cup. On the other hand, the lateral side of the knee joint is smaller and less stable because both the femur and the tibia are convex, outwardly rounded like a ball sitting on another ball, with increased translation, movement, and higher shear forces along that side of the joint. Accordingly, the meniscus on the lateral side plays a substantially different role than it does on the medial side. On the smaller, less stable, higher shear force lateral side, the meniscus serves to help mitigate each of these aspects, providing stability while increasing joint surface area to help distribute and absorb the higher stress of the shear forces. That's why removing a piece of the lateral meniscus can lead to potentially devastating changes in the knee. In Zion's case, we can only hope that the piece of irritated and debrided meniscus is relatively small, so as to only mildly disrupt the biology and function of the lateral meniscus, and thus reduce the chances and rate of arthritic changes. All in all, this is a concerning injury for Zion due to the functional importance of the lateral meniscus, the future risk associated with lateral meniscectomies, and inherent risks that come with his current playing and movement style. At the least, it could be a serious wake-up call for addressing those potential underlying causes and could prove to be a catalyst in Zion taking a more consistent and long-term approach to his health and fitness. That's a wrap for this video. Thanks for watching. My goal is to provide you with in-depth, evidence-based, narrative-free analysis, and you can always find me on IG and Twitter at 3CB Performance. Make sure to sub to that channel for the latest updates. 3CB out.